Hey guys. Okay, so let's get into pneumonia. Okay, let's get into the pneumonia, the bacteria or viral lung infection. Okay, that's your pathophysiology, bacterial or viral lung infection. Okay, the etiology behind this is typical organisms or atypical organisms. So that typical, the big difference that I want you guys to remember about typical versus atypical. Typical or more severe bacterial lung infections, okay, or viral. Atypical is that walking pneumonia. Sure, you guys have heard of walking pneumonia, which is a lot more mild. Okay, they have milder symptoms. That's that atypical. Okay, so let's get into this a little further. So it stems from either a bacterial or a viral lung infection. Okay, it's increased in our older adult population and associated with chronic lung disease, such as COPD. If you have not watched the COPD video, go back and do that first, then come watch this one. Okay, so there are several etiologies behind, again, that typical, the typical organisms that's leading to this pneumonia and the atypical organisms. So some of the I guess examples is S. pneumoniae. Okay, this is the most common bacterial cause for pneumonia, and it is again a form of typical pneumonia. Haemophilus influenzae, Moraxella catarrhalis, however the heck you say them, Staphylococcus aureus. Okay, group A streptococci. These are all forms as well of typical pneumonia. These are going to cause a lot more severe symptoms than an atypical pneumonia. Okay, there's also a form of aspiration pneumonia, and this comes from aspirating anything or things entering the lung cavities that are not supposed to be there. The only thing that's supposed to be in there is air. Okay, so other things, other foreign bodies, whether it be foreign fluids, or something that you eat, that you inhale, that you aspirate, can also lead to pneumonia if it's not removed in a timely manner. Okay, so some risk factors and things that you want to be mindful of, and of course we'll get into like the exacerbation of, but one of the risk factors associated with pneumonia is definitely older age. As I mentioned, it's increased in our older individuals. There's an increased incidence in those who are over the age of 65 as well. We know that their normal, the normal that's happening as we're getting older, our lungs and everything decrease in elasticity. They're not able to expand and relax as large as they usually were at a younger age. So that takes a part in this as well. Or even being able to breathe and even cough out anything that's in there, that also decreases as well. We know that as we age, everything starts to decrease. Okay, so this is one of our big reasons for hospitalizations as well, people developing pneumonia. So just be mindful of that. And then the impacts on its overall health, it can exacerbate comorbidities. So comorbidity, so if someone has COPD already, it could make it a lot worse. Okay, if somebody has asthma already, it could make it a lot worse. Okay, so the impact, it has a great impact for somebody that has pneumonia on our body systems and our organs. It has serious consequences. Okay, everything leads or everything happens in like a domino effect. One thing leads to the next. Okay. So what this is going to look like for your patients that have pneumonia, what are they going to look like? They're going to have a cough, okay? Definitely a cough. They're going to have some dyspnea. They're going to have that pleuritic chest pain, okay? They're going to have adventitious lung sounds. I gave you guys a definition in the last video. Adventitious lung sounds, it just means abnormal, okay? Abnormal lung sounds. Now, I know us as LVNs, we do not percuss, okay? We do not percuss, but if we were to percuss, we would have some tactile phremitis, okay, and dullness to percussion that would be found on examination, Okay, and back to those adventitious lung sounds, we're going to hear some rails, crackles, bronchi. Okay, that's what you're going to hear. That's the verbiage also that you may see on exams. Rails, crackles, bronchi. Those are the forms of adventitious lung sounds that you will hear for someone who has pneumonia. Okay, they will also need some lab testing and some diagnostic studies. Okay, preferably a chest x-ray. Okay, chest x-ray is the best method for diagnosing pneumonia. Okay, diagnosing pneumonia, the best method is a chest x-ray. Okay, this will reveal all the areas in the lungs. Okay, all the areas in the lungs where there's some infiltration present. Okay, as well as any potentials. You will be able to get a good picture for any potential severity. So if it's worsening over time, you'll be able to compare. So you get a chest x-ray when your patient first comes into the setting, and then you can get another one the next day and compare them. Is it getting worse? Is it getting better? Okay, so those are your clinical presentations and how you will test for it. Now, as the nurse, I always mention environmental factors and pneumonia and anything respiratory-wise leading to forms of anxiety. Calm your patients down. They cannot breathe. Okay, calm, focused approach is the best approach. Okay, that's the most beneficial. Set the mood. Create a calm situation for your patients. Okay. You also want to be mindful of, like, if it's mild manifestations versus severe manifestations. Okay, you also want to consider smoking cessation, especially if they smoke. Okay, those are home or environmental irritants. Okay, smoke, gases. Okay, so you definitely want to get that in a history as well. Do they may require a more focused assessment. Okay, look at, see if make sure their airway is patent. There's no obstruction. Okay, get a manifestation history. All right, any exposure risk factors. If they live in the home with someone who smokes, if they smoke themselves. Okay, your client education should focus on effective management of the pneumonia. Okay, with encouragement to mobilize and adhere to treatment therapies that are provided to your patients. If it's a bacterial infection causing the pneumonia, they will be on antibiotics. If it's a virus causing the pneumonia, if it's within the certain time frame, they may give them an antiviral. Who knows? Okay, so let's go through your nursing process, recognizing your cues. Okay, you want to get a full health history and a full assessment. Okay, your patient should be questioned about any history related to any respiratory problems. Okay, along with their current manifestations that they're exhibiting. 9 times out of 10, they're going to have some kind of fever as well. Shortness of breath, that cough, that chest pain, headaches, anything that can increase the workload of that breathing, you want to get in your assessment. Okay, then analyze everything. You got all of your assessment data. Now you want to analyze it. So once all the data has been obtained, you want to analyze the data for any signs of increased respiratory distress, any signs of hypoxemia, okay, any indicators that there could be sepsis, okay, maybe the bacteria is spreading. All right, look for any mental changes as well. Okay, then now you're going to prioritize your hypothesis. So when prioritizing the care for these patients, your ABCs, first and foremost, ABCs. I can't stress that enough. Okay, but when prioritizing care with any respiratory disorder, you must first make sure that they have a patent airway and adequate oxygenation. Okay, assess their respiratory efforts, their lung sounds, their pulse ox. Okay, that's the first thing. First things first. Then you're going to generate solutions. Okay, you're going to collaborate with the team, the healthcare team. There may be a pulmonologist present, the healthcare provider. Okay, you're going to collaborate with everyone and generate some solutions so that you can get some positive outcomes from this patient. Okay, now take action. Remove any removal of any secretions that are there, all right, to improve patency, and coughing exercises, okay, that cough and deep breathe and all of that. a lot of the times it's going to be a productive cough, as I stated. So some saline also might be given to kind of loosen the secretions and help get it off. Some suction, all of that may be included, but it just depends on what the healthcare team comes up with in their care plan. Okay. You also want to elevate the head of the bed. Okay, change positions frequently. All right. Promote chest expansion. Okay, we need to help get that, get those secretions and all of that stuff kind of clear. All right. So, and then evaluate your outcomes. Did it worsen? Did it improve? Did it get better? Did it deteriorate? Did it stay the same? Okay, because if it did not improve, or if it's staying the same, okay, there's no signs of improvement, then you're going to need to run it back. Okay, you're going to need to reassess and go through everything all over again. All right. So that is pretty much your pneumonia. The only thing that I want to point out is, again, monitor your manifestations. You want to see some improvement within 24 to 48 hours after antibiotics has been initiated. Okay, 24 to 48 hours after antibiotic use. Okay, your vital signs should also be assessed with oxygenation, the pulse ox. Okay, both should be showing signs of improvement. That's what you want to look for on your evaluation. Okay, increased oxygenation, better mental status, and just an improvement from the baseline that you got initially in your initial assessment. Okay, and that is it for pneumonia. Okay, hope this helps. Happy studying.